Okay, obsessive compulsive disorder. So the obsessive part here is the thought, and the thoughts are unwanted and they're intrusive and they're impulsive and they cause the patient a lot of anxiety. Okay, and the thoughts can be centered around having things in a particular order or maybe fear of contamination, anything like that, but it's not usually centered around real life problems. Okay, the compulsive part is the action. Okay, the unwanted repetitive behavior, and the behavior reduces the anxiety. The behavior is not done to invoke pleasure, and it's time consuming. Okay, they can wash their hands like 50 times a day, or like tie their shoelaces and untie them, and tie them again and untie them, and it could take up to an hour or more even. So it interferes with their daily living, and it really interferes with their social life and their work life. Okay, so Freud believes it's from an underdeveloped ego, and they believe that that person has regressed back to the infantile superego, and you know the superego is very punitive, right, and harsh, and now these aggressive feelings are manifested into these compulsions. Okay, the learning theory believes that it's a conditioned response. So something happened that was traumatic, and now the person would want to avoid that event from happening again, so that would be passive avoidance. But because they can't avoid that situation, they might do these actions to relieve the stress, which is active avoidance. Okay, so passive avoidance is avoiding the situation altogether, but because you cannot avoid the situation, you might do things to relieve the anxiety, which is active avoidance. Okay, but the problem with the learning theorists believe is that the obsessive compulsive disorder might have come about due to a traumatic event, but often these patients say that the problem was gradual. The behavior was gradual, not after a particular event. So there's some holes in this theory. So the biological aspect of it is that we've seen abnormal metabolic rates in the orbital frontal cortex and the basal ganglia. Okay, so a way that I hope it can help you remember this is obsessive compulsive disorder, 3 words, orbital frontal cortex, 3 words. Obsessive compulsive order starts with an O, orbital frontal cortex starts with an O. And basal ganglia, I don't know. Obsessive, there's a B after the O, and this B is after orbital frontal cortex, and it's basal ganglia. So hopefully you can remember that. I don't know if that helps at all. Okay, and these patients do show a decreased level of serotonin, and that's why they would be given SSRIs. It does help these patients. So remember, obsessive compulsive disorder, orbital frontal cortex, and basal ganglia, and they show a decreased level of serotonin, and that's why they're given antidepressants. Antidepressants such as MAOIs or tricyclics can be given as well, but SSRIs are given because they don't have as many side effects. Now, the short-term goal for these patients is to decrease that ritualistic behavior. Okay, that would be like a short-term goal. So you could say, by the end of the week, the patient will show a decrease of ritualistic behavior by half. Okay, that would be a short-term goal. A long-term goal would be by the time of discharge from treatment, the client will demonstrate the ability to cope effectively without resorting to obsessive-compulsive behaviors or increased dependency. So maybe the behavior becomes worse during times of stress, but instead of, performing the compulsion, they have figured out ways to control their behavior. Okay, and what the nurse wants to do is she doesn't want to judge the patient, okay, and doesn't want to make the patient stop doing the behavior altogether immediately. The goal is to reduce the time in which the patient is given to do the behavior, and gradually, basically, move them towards behaviors and activities that are more adaptive. Okay, so reducing the time in which the patient is doing the ritualistic behavior and giving positive reinforcement for non-ritualistic behaviors. Okay, so positive reinforcement will cause the patient to do things that are more constructive, right? Okay, and basically, you know, the role of the nurse is going to be supportive, right? Supporting the patient to explore the meaning and the purpose behind the behavior, and give the patient a structured schedule of activities, you know, something to reduce that anxiety and give structure in their life. But, okay, so remember, obsessive is the thought, compulsion is the action, orbital frontal cortex and basal ganglia is the part of it shows abnormal metabolic rates in these areas, decreased serotonin, that's why we give antidepressants, and the goal is to decrease or eliminate the obsessive behavior and replace that behavior with something much more productive.